I'm here to demonstrate 7 special tests for the hip and lumbar spine. Another special test for hips is the performance test. And here you'd have the person lie on their unaffected sideline, and you'd be supported, but here you would take the affected leg and you would flex the hip of the affected leg about approximately 60 degrees, and you would comfortably flex the knee here, and then you basically support the hip and you would press down. And a positive test, you'd notate tightness, limits motion in the patient, but he obviously has none. But the signs of tightness or pain here would indicate tightness in the abductors and the buttocks, and tightness in the buttocks and the posterior hip would indicate sciatic nerve impingement secondary to a tight performance. Special test we can use for the hips is a test for hamstring tightness. And that consists of having the patient lie supine. The test is called 90-90. Having a patient lie supine, then asking them to bend their knees together and support that with their hands by remain supine and keep their head down and shoulders flat. And then asking them to alternatively extend one leg at a time. And then what you do there is you notate the degrees, the number of degrees from extension that they can, number of degrees they can do from complete extension. And for males is normal range is from 20 to 15 degrees. And so you just rotate this up again, and then you measure. And for females, the degrees from complete extension is 10 to 15 degrees. And you do each leg alternatively and measure the difference of degrees. Tests for the hip include the Faber or Patrick test. Here you have your patient lying down supine. You would flex his leg, the leg that's in question, flex his leg. You would abduct it, and then you would flex it and place the affected leg on top of the unaffected knee. From this point, you would support the hip and you would press down. And if you notated limited motion within the hip movement going down, that would be indication of iliopsoas, sacroiliac, or possible hip pain or injury or damage. Another test that tests both the lumbar and the hip is the Trendelenburg test. Now here, we're testing for hip strength or abductor strength. So if I ask the patient here to raise his right leg and hold for 10 seconds, you note the level of the hips. Now, if this hip drops, then that's a sign that the abductors, the gluteus medius, is weak on this side. So, and then put your leg down. Now, if you raise his other leg, now if the unsupported side drops, again, hips drawn this way, it indicates that the gluteus medius, the abductor, abductor, is weak on this side. And that's a test, again, for both lumbar and hip. Another lumbar test is called the well straight leg test. This is a test where you're testing for possible vertebral damage on the lower sacral spine or lower lumbar spine. This is basically you approach the subject from the uninvolved side. So here's our patient here who's complaining of pain, possible little discomfort on this side. So the test is to hopefully include this out, not rule it out or include it, but to hopefully maybe focus more on the problem. So basically here what we need to do is you take your one hand, you put it on the anterior distal portion of the individual's foot above the knee, distal femur, and the other hand underneath the calcaneus, and as a unit you flex the individual's hip, and as you flex you ask them if they're having any pain on the opposite side, above the opposite leg. So as I raise, any pain or discomfort? Yep, pain. That is when that is a positive sign for the Wells straight leg test. The lumbar test I'd like to run you through is it's called the Hoover test, and this is a test to test for neuromuscular weakness. So here we have a patient who claims that his left leg is not functioning, has weakness. So in order to carry out the test, you basically put your one hand under each of his heels, and then you would ask the patient to raise his affected leg from the hip. Try to attempt a straight leg rest.
Yeah, I can't do it.
You can't do it?
No.
But while you're doing that, you note what you need to do is you note the pressure not only underneath the left leg, but underneath the right leg, because normally when a person is trying or exerting to make an effort to raise a leg, the opposing limb or leg exerts pressure downward. And if you note the pressure, if I note no pressure underneath my right leg showing that he's not giving any effort, it's very likely or possibly that the client or a patient is faking it. So that's another test to rule out or rule in potential lumbar problems. For the lumbar muscle test, basically we're testing for sciatic pain and whether or not it radiates through the limb. Here, basically we begin with the patient relaxing. I grab underneath the ankle and underneath the thigh, and I slowly raise the leg until the patient reports pain. Okay, report pain. So once you report pain, then you slowly flex the leg, flex the knee, until the pain dissipates. So the pain, once you reach the point where the pain dissipates, then you palpate, probe on the palpebral fossa behind the knee, and you try to recreate the pain. And then if you recreate the pain, then it's a likely sign of sciatic nerve compression.